Greetings, this is Dr. Douglas Maurer from iMedical Apps with another medical app review. Today we're going to be taking a look at a new medical calculator. This particular calculator is focused on evidence-based medicine statistics and comes from the EBMcalc 3000 company. It's called EBMstats. This app contains over 50 different calculators based on evidence-based medicine, which you can see here are arranged alphabetically. You can scroll back up to the top. It also includes some free, just basic converters for dose and unit conversion. You also have the ability to search. So if you wanted to type in NNT and search, you'll see some of the different ones that come up for that. Click on it, it opens. So what's great about this app is it does contain a few specific calculators that I can't find anywhere else that are described in various evidence-based medicine textbooks, such as using a patient expected event rate. So let's, for example, pretend we're in clinic seeing one of our patients who we believe would benefit from a statin for hyperlipidemia. However, we want to use proper evidence-based medicine statistics. So for example, if we use the pooled equations calculator and calculate that this patient's event rate for a coronary artery disease in the next amount of time is, say, 12%, and we know that the odds ratio for the use of a statin for preventing heart disease, we'll just kind of make one up, but it's about anywhere from a 30 to 50% reduction. So we'll use 0.65, or you can change the ratio here. So I could say it's 67% or a 37 or 40% relative reduction. Here we're using odds ratio. So let's just use a percentage there. And it'll give me the number needed to treat for that particular calculation. You can also see the calculation itself listed at the bottom. There isn't a lot of explanation of what that means to have a patient expected event rate, and many of the calculators here don't have any type of explanation. Look at chi-square analysis, for example. Gives you a basic note and the equation, but nothing more about perhaps when you'd want to use a chi-square analysis. It's one of my criticisms throughout the app. Some places, though, there is good information. So, for example, if you, again, wanted to figure out cost associated and add that to the NNT, and let's look at statins maybe again, and say our statistic for benefit of statins was over a period of 5 years, and the daily cost maybe was cheap if we used a generic statin, more expensive if we used brand name, but we'll just say it's $1 to keep it simple. We can say the control event rate for folks who don't use statins in the control group, we'll say that rate is 4%. And those who do use statins, there's an absolute benefit of, we'll say, grossly 2%. It'll show us the number needed to treat as well as the cost of preventing an event. That's the COPE statistic. It also includes here a reference going to the ACP Journal Club. These are some of the things that you can do with this app that I've not found in any other statistical calculator that's for a mobile device. Certainly it has a lot of the classic ones that we'll see, sensitivity, specificity, but also conversions of pre-test to post-test odds. And you already saw the peer and COPE. So some things I like about this, there's over 50 different EBM calculators, most of which I've not found in any other medical calculator. It also throws in some bonus unit and dose conversion calculators for free. I also like the fact that it has references, some of them to quality sites such as the ACP Journal Club. It's also available for Android. Some things I don't like about this particular app is there really are no explanations for the majority of the calculators that are included, and many don't have references. This particular example, though, does, so it is a little bit hit and miss. There's no ability to make any of these a favorite. There's no favorite function here. And even just getting back up to the top of the app sometimes is a little bit unnecessarily scrolling. So overall, I think this is a outstanding addition to the App Store, as there's really no other app on the market right now that includes this number of evidence-based medicine statistics. And if you really want to try to use the statistics of EBM at the point of care, this is